is when we deal with the embryology, the periviable lungs. I mean, how is it possible to survive without alveoli? You know, because these babies are being born during this fetal period and basically born during the canalicular phase. And really, you don't have much alveoli, and hopefully you do have some alveolar saccules. So the concept is you have terminal bronchioles as you're developing, branch to respiratory bronchioles. Next stage, you branch to alveolar ducts. Now, the interesting thing is alveolar ducts, when they terminate at the tip into a alveolar sac, an alveolar sac allows gas exchange to occur. The alveolar sac is thin wall and vascularized, so we can exchange CO2 and get oxygen in. And that starts to happen at 24 to 27 weeks. It doesn't really happen theoretically before 24 weeks. But when people looked at autopsies, they could find that the cranial segments of the lung mature faster than the caudal segments. So the entire lung does not undergo lung development in a homogeneous fashion. So you do have a few areas of the lung that are now mature enough to survive even at 22 weeks gestation. But the key is don't damage the lung. And that's the key. So two main things. You need the antenatal steroids, which helps to accelerate this maturation process. And key, it helps to thin out the mesenchyme so gas exchange can occur. And then you need a lung protective strategy. You need to minimize the volume trauma.